good evening. I'm here with Jacob presenting machine learning coursework, and the topic uh, presenting on is prediction of HIV patients with a machine learning model who are on ART treatment, likely to develop drug resistance on first and second line regimens. This will be with the support of the support vector algorithm. I will be running this on laboratory test data. My group has myself and Senoga Badru. So this is the problem we want to investigate. We want to investigate that, yes, we know that HIV is one of the most complicated conditions affecting the human population. And consistent treatment has been on antiretroviral therapy, ART, which has been used to extend the life expectancy of HIV positive individuals for as long as that person is consistent on this medication. It will bring the viral load below detectable levels, which makes them healthy. Now, a definition for drug resistance can be conferred at a time of HIV transmission. So, treatment of patients who are resistant on ART drugs can lead to drug failure. So, what this means is we have people who are not aware that they are carrying the virus, and in the process, they will become, due to mutations, they will become resistant to the drugs. So analysis of drug resistance data is critical in treating HIV, and very important in HIV research. So one of the other issues is we want to predict patients that are failing on these regimens, the first and second line, which are the initial regimens meant to help the body fight the virus. And the focus is lab data. So the background to this, we have about, currently, as of last year's statistics, there are 38 million people who are living with HIV worldwide. And we have about 1.3 to 1.6 million of those living in Uganda. And last year alone, 650,000 people passed away from AIDS-related causes. And one of the factors contributing to their deaths is non-adherence to the prescribed medication and recommendations by physicians. And this can range from dietary to taking the medication on time. Now, equipped with this evidence, we believe that a machine learning model to predict which HIV-1 patients, HIV-1 is what is the prevalent HIV in the Ugandan setting. So we're looking at developing a model that will help predict which patients are likely to switch from first line and second line regimens to eventually third. And we believe this will be best done on utilizing laboratory genotypic test data. The study is going to be quantitative in nature, and where we'll be seeking to look at the relationship between the treatment regimen and drug resistance, which will hopefully provide answers to the treatment regimen that has the lowest drug resistance score, and this will help provide new approaches in the treatment combinations for HIV patients. So significance of this project. So this project will help us, the model will help us in identifying patients early that are likely to fail on the regimens, basing on lab test data, uh, putting aside the clinical data which involves behavior. This will help lead to a reduction in the mortality rate of HIV patients in Uganda, because we'll have found better treatment um, combinations. Then this also model will also help in assisting in identifying mutations and the best drug combinations, as mentioned earlier. The project scope, we intend to look at and analyze data uh, from a lab setting, primarily looking at patients who are on first and second line data. We'll be looking at historical data longitudinally, and then we can use that to see and look out for those that are having changes in their treatment lines. So the problem statement, due to the mutative nature of HIV, drug-resistant strains can be transmitted from one patient to another as a result of patients' non-adherence to the recommended treatment measures. And drug resistance stems mainly from inconsistent consumption of medication. And knowing HIV as a virus, it will mutate, and the medicine, the medication the patient is on will no longer be effective in their treatment, which which eventually equates to the drug resistance and its complications. So our questions, research questions, we are interested in looking at regimens that have a high number of patients changing from first, second line, and eventually third line treatment. We also want to see, are there any regimens where we have a low number of patients experiencing this drug resistance or changing from first to second line, based on previous test data. Then we also want to see, are there any regimen or drug combinations that can be used to give better results in HIV treatment? And the hypothesis, the null hypothesis is, as a result of the use of the machine learning model, there will be no significant improvement in the detection of HIV patients that are highly likely to develop drug resistance. And the alternative hypothesis is, as a result of this model, there will be a significant improvement in the detection of HIV patients that are likely to develop drug resistance. I'll stop at this slide and hand over to Badru to continue with the remaining ones.
From where my colleague
Thank you very much.
So, of course, from hypothesis, we need to know whether the result of the module uh, is negative or it is positive. So, to do that, we shall need to have some research objectives, and one of that is to identify the clients and regimens that are most likely to encounter drug resistance. So, of course, we have to also use the results as a means to adapt new measures of treating the HIV drug resistant patients. So from that we have to use the data set, and we collected the HIV patient test results from samples that were collected from different health facilities across Uganda, between the age of 0 up to 70 years, between that age bracket. So the results are sequenced for drug resistance with the genotypic approach, and the study that we shall have is to compare the use. We expect to have great success by using support vector machine algorithm as our pattern recognition technique. So this is much better compared to the rest of the other traditional methods, whereby they don't work well, especially when it comes to multivariant risk factors with small effects, especially if you have a small size sample like ours, you may have some limitation, and especially even when it comes to knowledge of you differentiating which one is positive, which one is negative.